is Wednesday, November 13th, 2019. It is 6:38. And this is, I'm calling to order the Snoqualmie Valley Hospital Board of Commissioners meeting. And this meeting is mostly based on our district budget for calendar year 2020. So will you join me in the flag salute, please?
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Would the clerk please do the roll call?
President Norris.
Here.
Vice President Herring.
Here.
Secretary Spikers.
Here.
Commissioner Pollard.
Here.
Commissioner Carter. Here.
Do I hear
I move approval of the budget of the, rather the agenda.
the agenda?
I have something to say.
We were in a short meeting. Let's go home.
I'll have something to say about the budget later.
Okay, good.
Do I hear a second?
I second.
Any discussion? Hearing none, we'll go to a vote. All those in favor say aye.
Aye.
Opposed? Okay, that passes. Okay, new business, presentation by the district budget for calendar year 2020.
Okay.
Steve, you are on.
I'm on, thank you. As President Nora said, we're going to present the budget and a couple of things. It's a budget that assumes we do not affiliate next year. Now, we probably will. Timing-wise, we don't know. So we said, okay, let's stand alone. We're a standalone district. That's how we're doing the budget. So we're presenting the budget. The other two items that you'll see are then approving the resolutions that allow us to access our property tax revenue. So, talking about the budget, it's, okay, no changes from what you saw last week. This is the, what I call the final budget. And it takes us, we started this budget process in September. We meet with every department, go over their budget request. Well, what's a budget request? A budget request is, okay, we can perform this level, and we think it's realistic, of procedures. Okay, revenue budget. To do that, we need this level of resources. We need staff, we need travel, we need training, that kind of thing. And we sit down, have meetings with every manager, and get the department budgets, then roll it up to the organization's budget. So, and in the budget meetings are our controller, myself, chief operating officer, and chief CEO. So we all, and it's a friendly but questioning process, I would say. I mean, we don't beat anybody up or anything. So.
Did you mention the controller?
Yeah, Jim Baldock, our controller. We'll look a bit about volumes. We're very conservative on volumes on existing programs. I like to go in with a conservative budget because you can grow and increase, have a better outcome than you budgeted. We have two new programs that just started but will be operating all year, Sleep Center and Reference Lab. Both I'm going to give Kim Whitcock credit for coming up with the idea and just implementing it.
Parliamentary inquiry, please.
Yeah.
What is a reference center?
That
Lab,
would have been my
reference lab.
question.
Reference
The
lab.
reference lab, yes.
This has come up several. Is that that's the black lab in the orange warrant?
This is we provide lab services to clinics in the community. So this is not our clinics, these are other clinics, and they ship their labs in that they drew in their offices. Or we actually have two draw sites that we staff, so they send their patients in and we draw and bring samples in here and process them.
And we process get the lab results and send that back to them.
Yeah.
All right.
Thank you.
Yeah, so it's called a reference lab because it's located not in your out to a reference lab. Lingo.
Okay. Talked about the manager input we've received, and patient volumes and expenses. There are salary increases, cost of living, and then some, kind of a fancy word, tiered market-based assumptions. What we did is a very in-depth analysis conducted by a whole number of people, the executive team, HR manager, and looking at, okay, we realize we have to pay people at what the employment market is. But we also realize, CFO in me says, okay, we have to control expenses. So how do you balance that? And we went through a number of iterations to come up with an overall salary increase. If everybody was getting the same increase, it would be about 3.5%. Not everybody is. And so that, and the cost of living, the CPI, Consumer Price Index for this area, is 3.2. So we stayed very close to that inflation level. Commissioner Spikers, or Commissioner Pollard, you bring up.
You want us to ask questions as you go along?
Sure,
or at
sure.
the end?
No,
Well, the COLA, where did you get that figure, 3.2?
it's from the Bureau of Labor Statistics for this area. You are going to bring up to me that Medicare is a 1.6, or Social Security is a 1.6. That's nationwide. We are in an area with a higher inflation than most of the country. And if you look at third quarter Consumer Price Index, those are the numbers that you see. Federal government computes the Social Security based on one number for the whole country. It's really fair, but it's mandated by law. So,
And that is a COLA, the cost of living allowance.
yeah.
As opposed to a CPI, which is a consumer price index. They use different components and different figures,
Yeah.
so they're not interchangeable.
Yeah.
Right, but the federal government is also 1.6. Well, they're going to announce that next month.
That's
Social Security's already been announced at 1.6.
mhm.
And there are differentials for certain areas, but that has to be passed through legislation.
Yeah.
So I don't know, it just seems to me that's awfully generous when we have so much indebtedness, where we could match the Social Security, add a little, maybe go to 2%.
Mhm.
But 3.2 just seems to me awfully high when we're that much in debt.
There are a couple ways to think about that. One is, yeah, you could cut it down. The other is if you start paying lower than market, you get what you pay for in employees, and the talent level of your employee base goes down, and you have a higher turnover. And by turnover, I mean people leaving to go somewhere else. And that has a pretty significant cost because we bring people in, we have to train them and such. And then when you have turnover, you have to use agency staff. And an agency person, so like a nurse from a staffing agency costs 20% higher than someone we hire.
But you
Because,
don't pay them benefits.
what?
There's no benefit for those people,
There are no benefits for those
right?
people.
For the
but-
agency,
yeah.
because they're not employees.
Mhm.
Well, we give them no benefits, but their
Their-
very agency.
Their agency gives them
provides
benefits and the agency takes them
That's what
back.
I'm saying, but we're
Yeah.
not. Okay, let's.
Yeah, yeah, we don't buy them health insurance.
Do you have any idea how this compares with overlay since we're getting so close to them? What kind of COLAs are they offering?
I do not know.
It'd be interesting to know.
Yeah.
I don't know, so,
I would-
I could guess, but I don't know.
Okay.
Okay.
Commissioner Herron, do you have a question?
Question,
Any other
yes.
questions?
You mentioned salary increases that, and you said everyone gets 3.5%
No,
increase?
I said it's different. Our overall average is 3.5. But say you are being paid lower than the market, the employee market here, you get a little higher increase. you're above, you get a lower increase.
So you're basing it on employee market, not on a fair market value?
Yeah, employee
Is
market
that
is
what it
fair
is?
market value.
Is that
We
the same
subscribe to a
that you-
number of surveys. The biggest one and the main one in healthcare is the Milliman survey for healthcare. Says what are positions paid in this area and also this size of hospital. We look at size and area. So we want to make sure, you know, we want to make sure we're looking at comparable data. Questions, comments?
Anybody else have a
David?
question?
Yeah.
Your goal is good for one or two.
I'm gonna get to that one page where it says patient revenue projected. I don't think we're gonna get to that compared to what we had today or this year projected. Quote me if I'm wrong, but I
Okay.
think we're gonna end up somewhere around 38 million this
What
year.
page are you looking at?
Yeah, what are you looking at?
I'm looking at like the 5th page. I said I'll wait.
Okay, well, why don't you wait till we get there?
He said he'll wait.
I see what you said.
He said he'll wait.
Okay, all right. You warned me. Thank
This
you.
is kind of a bit important I
Okay.
think, to be able to explain.
Okay.
You've got a patient revenue that less contractual projected at about 37.5. And this year, plus our tax
Mhm.
base, which is another 4 million,
Mhm.
whatever. So we're right around 42 projected.
Mm-hmm.
And this year, I'm looking at what we've had so far,
Mm-hmm.
and we're up, I'm projecting somewhere around 34 million plus tax revenue. About 38 million.
Okay,
Does that seem somewhat reasonable, give or take a $500,000?
close, yeah.
Okay? And so how are we gonna get to the 42 million? I know that we net in these two new programs 1.2 million.
1.2
So
to
we-
1.5.
So you gotta come up with another 2.5 million at least in revenue to make this, but where's it gonna come from?
Okay, you have net revenue of 37.5. Okay?
Yep.
Yeah, you've got, we're gonna probably get to 34, 35, say 35, 36, somewhere. We've got two new programs coming in
Mhm.
for $1.2 million, $1.5 million.
Net
And then
1.2.
we also, our costs are going up, okay? We are cost-based reimbursed. When our costs go up, we get an increase in our payment from Medicare. That's the advantage of being cost-based reimbursed. So I factored in that increase in cost-based reimbursement, did an analysis by department, because each department has its own cost-based reimbursement percentage. And so you get a bump. It's one of the advantages of being cost-based reimbursed.
But
And it's and it increases your net revenue.
2.5 million?
It'll increase it, probably, it won't be 2.5 million.
Well, that's what I figured what we need.
Okay, well, we've done this in excruciating detail
Okay.
and have come up
I
with it.
believe you.
Okay,
I believe
all right,
you.
okay, all right.
Can I answer, following up on that revenue, and you're talking about cost reimbursement
Yes,
on patient, and we're looking at the patient volumes reasonableness test, the 2020 budget, looks like it's all on the minus side. How are we going to explain other revenue coming from there, from Medicare reimbursement?
Okay,
tax
cost, okay,
revenue?
Emma, cost-based reimbursement is not tied to the number of procedures you do. Cost-based reimbursement is tied to your expenses. It's cost-based, it's based on cost. And we get 50 to 60% of our costs reimbursed by Medicare. Depends on what department the increased costs are. But we did an analysis on that and let's recognize some of that. because it's true, it's real.
So are we going up to maybe towards $3,000 per patient day next year, you think?
Well, right now, we had, the latest test we had was 2,900. And so probably be a little above that.
If, just a little bit of background, we were at somewhere around 2,800, 2,750, I think, for a while.
Mhm.
And we did another correction, so now we're up to 2,900.
Yeah, we just got in our latest test. We'll have one more done by the end of the year. And our daily rate is around 2,900.
But we were up to about 3,400.
Oh, well, yeah, one
We
time.
were up to almost 4,000.
Yeah.
We're almost up to like 4,800.
Okay, anyhow, and I think the thing that public doesn't understand is that cost-based reimbursement is not just the cost of the procedure. It is the cost of the land, the
Facility,
facility.
Yeah. Mhm.
All of that, and the public doesn't know that, doesn't understand that. So it sounds awfully high, but those are indeed costs of the hospital.
Yeah, it's cost of the hospital, and, we do a cost report, and that is to determine our reimbursable cost. And that is going to go up next year. That helps us with revenue.
Depreciation, now that's diminishing.
Depreciation's going down a little bit.
Yeah.
But again, I think it's a reasonable budget.
It's just, I can't see somehow, unless we change our payer mix to be scrutinized to be Medicare or Medicare Advantage based more.
We can probably gain by changing that payer base more, just a little bit towards the Medicare Advantage. But we set our payer mix is about what it is right now. So.
What are we gonna get on tax dollars? Is there not an increase in property values and stuff that we would get?
Yeah, we'll get a small, about a 2% increase in tax revenue. We'll talk about that. Yeah, maybe that'll help.
Yeah, we'll be at around 4
Mm-hmm.
4 million,
Yeah,
so pretty close.
about 3.9 to 4.
And with the population growth around here and the houses being built, that's pretty substantial, isn't it, compared to
Mhm.
what it was 10 years ago?
Mm-hmm.
Yeah.
One of the things, David, you're gonna see in next month's financials is we had been understating our daily rate. And it's gonna move up. Your revenue's gonna increase because we got that test in mid-month, last month, so probably get a bump there. I'll probably save a little bit in contractual reserves. So,
Okay.
but
Well, if we
that,
went up from 2,850 where we were to 2,900, that's substantial.
yeah, and it, I didn't wanna bump it up until we got that test in, and we just got it in about 2 weeks ago. And we got a lump sum payment of $773,000.
Well, that's not bad.
Yeah, so,
Yeah, I just,
Yeah.
worried about that 2.5 million, where it's gonna come from. And, I look at it because we haven't increased in revenue that much in any one year, and you're not looking at substantial gains in patients. So,
no,
that's where I can't logically.
I still think we can make that, so. With the increase in cost-based reimbursement and the growth in the new programs. And you've gotta realize we'll have a full year of, the 340, or of Kroger on the 340B. That's gonna help by a few $100,000.
So, the gross, or the salaries is gonna increase just over $1 million this year, from this year, right?
Mhm.
Somewhere, I think I calculated it, all
About-
things being equal.
Probably, yeah.
At the end of the year, it's
Mhm.
just under 18 million in salaries.
Mm-hmm,
So-
that's about right.
19 million, if that's what we're anticipating. And we're talking about all of the salary increases, the benefits, all those things. Are we gonna be taking on any more new employees, let's say for the reference lab, maybe that gets going, or, I mean, is there gonna be something that, do we anticipate everybody's salaries and
We did.
and the new persons on the block, so to speak, coming in?
Yeah, we didn't leave anybody out.
Okay.
Yeah, we did not leave anybody out.
Okay. Well, those are my concerns.
Okay,
So the 19 million, I just wanted to be clear, is just for the COLA and does not include the CEO compensation stays the same, is that right?
no,
It's all
the
salaries.
CEO has an increase built in, because we talked about giving at least a COLA. We also talked about last week, the potential of a performance-based payment. And again, factor that in, because it's performance-based, mid-year. And then, I think we talked about a payment this year. So-
I asked that all be included, just in case.
Mhm.
I wanna see
Yeah.
that in the budget, the worst, best case scenario.
Mhm.
For Dr.
Yeah, so we've got that
So,
But
in there.
putting that in the budget, doesn't that preempt the decision? about-
No.
No, it
No,
doesn't.
it's just-
The board controls it.
The board controls it, it's not,
I
it's
know,
there, it's not an
Technically
automatic.
speaking,
Yeah.
yeah, that's correct, but
Yeah.
it does kind of preempt the board's
So it would-
thinking.
No,
No,
I didn't
no,
mean
it
to preempt the
doesn't.
board, what I wanted to be is, if the board decided, I didn't want it to be
Okay.
a financial hit to keep
Well,
going
no,
up.
I
Yeah,
understand.
See,
yeah.
I-
That's, everyone understands.
I didn't wanna have, let's say we didn't include it, and the budget was break even, and then it becomes, $50,000 loss,
Yeah.
or whatever it is,
Yeah,
and now we didn't plan on
I
it.
agree,
Yeah,
but
that
it would
really
have been
makes
better if
sense.
we had settled on the salary before the budget.
Yeah, not
was
so
all
much
set.
about preempting, but more of provisional for
Yeah,
now.
provisional.
I think that's
Exactly.
better.
That's
So
good.
let's do it
That's
as a
good input.
provisional until all the questions that we are going to be
Right.
addressing next
Right.
month will be answered, and all the requests that we make.
I think there is-
Provisional, not preempting.
Yes, exactly.
Okay.
Put it perfect.
Okay, so. Okay, again, we've got, growth in lab and, growth in clinic, sleep, based on the sleep program, but otherwise pretty much flat volumes. And on the inpatient and outpatient side, I think we can probably exceed that in some spots. Again, we wanted to be conservative, so.
Well, I was simply amazed how you predicted less patients coming into the hospital in most areas, which to me would mean that you ultra
We also increased our price.
conservatively
We have-
projected.
We also increased our prices. I
So-
mean, we plugged in a price increase, which
So-
we're allowed to in our payer contracts. So that's, I think, what you're missing, is we,
That's smart.
5% price increase.
How has the Medicare adjusted their reimbursement?
Medicare reimbursement for the inpatient side, I was just talking, just went up a couple hundred a day because of that the cost-based reimbursement.
Okay, without the cost-based reimbursement, what's the percentage increase of Medicare reimbursement?
Well, Gene, our Medicare reimbursement on the inpatient side is, we are cost-based reimbursement.
I
on
understand.
Medicare. Okay,
I just wonder how much Medicare reimbursement has increased for this year, or the forthcoming year.
on the
And I'm not
inpatient.
talking about a cost-based reimbursement. Let's say we didn't have cost-based reimbursement, we're just normal hospital,
Mhm.
non-critical access, and we were depending on Medicare reimbursements. Certainly, they increased the Medicare reimbursement by some percentage.
Not very much.
Not very much.
Not
No,
very much at
they
all.
don't.
And
Yeah.
you should have been notified, because everybody's on Medicare gets
I hadn't-
notified.
Well, that's a different question.
Different.
He's not asking about the individual's cost, but
What the hospital receives.
Yeah,
for
I'm
the
not talking about
services.
what
Yeah.
I have received notice about what I'm gonna have to pay in addition, but I'm thinking about what will the hospital gain based on the increased reimbursement rate, without taking into account cost-based reimbursement. I don't know, if you can't provide a figure, I won't waste your time further.
I think it give you a perspective, so, you know the terms MACRA and MIPS, so
Yeah,
those
I know.
are incentive-based payments, so Medicare has moved away from having an escalated, a year-to-year escalation in their payments, especially when it comes to the professional payments, and instead what they do is move, and so any increase that you get is around your incentive, so compliance with those, the MACRA and the MIPS program.
They still use DRGs, so,
DRGs applies to inpatients.
right, that's what I'm talking about.
And, so not at a critical access hospital. So, at a traditional hospital, like you described a traditional hospital, they still use DRGs, yes. But not at a critical access hospital.
Okay.
Are there any other questions?
Well, getting back to we might be very well at $3,000 next year, cost-based reimbursement,
It
which
could
is
be close to that.
what we
yeah.
estimated, pretty close to about $200 more per
Mhm.
patient day,
Mhm.
right?
Mhm.
I mean, I'm not,
Yeah,
it's
yeah.
not stone. I just want to give the board an idea what that means in actual revenue. So if we have 15 patients in Medicaid or Medicare, and they're in there for 30 days at $200 more, what do you come up with
Oh, we get-
per month? It's a pretty sizable figure.
Yeah,
$200 per day, per day?
I think it's like,
Uh,
Times, 200 per year?
so they could do it
Times.
right.
I think it's like 100 grand almost,
Oh, more than that, yeah. It's,
times two. It's like it's 200,000.
yeah, well, okay, so we've got, let's go back. We've
I
got
think that's
total,
where the-
total patient day, inpatient days
Calculate
of
90,000.
8150.
How much is it?
90,000 a month. times
Yeah,
that's
12.
what I thought.
90,000 a month,
Would
8150.
equal 1,080,000.
Yeah.
Okay,
It's
so
about
1.1 plus, we're still short 1.3. Okay, I'm assuming 15,
Yeah.
which is a pretty good percentage for
It
Medicaid,
is.
Medicare inpatient, right? Out of 20,
No,
24?
it's,
Is it more than that?
oh, yeah,
Of our Medicare inpatient?
Okay.
oh, yeah,
Yeah.
it's
Of our,
like,
of our 20,
Inpatient.
of our
Swing.
25 to
24 to
25
25
days.
census, 23 to 24
Yeah.
of them are.
Okay,
at some point, it's all Medicare, or maybe all except
so
one.
maybe it's 150,000 a month,
Oh, at least, yeah.
okay.
Mhm.
So if we're using Medicaid and Medicare interchangeably.
No,
Medicaid and
no,
Medicare-
we should have said Medicare.
reimbursement is much lower than Medicare.
Right.
Yeah,
reimbursement.
Medicare.
Right, and we target
250 bucks a
Medicare,
day,
Okay.
yeah, on the inpatient side,
If that.
yeah,
Okay, so we're getting closer.
yeah, we got
So
1.5 on that. And then you
1.8
got,
plus 1.2 is 3, we're still short of almost a million.
1.7?
and then if you look, okay, so
I added the 1.2 net on
the 1.2,
the new programs,
so new programs are 1.2,
yeah,
okay?
net.
Medicare, inpatient days, on the 200 we just got, you got another 1.5 or so. And then your costs going up are worth about 800,000. So you're there.
Is that
40B.
before contractual adjustments or after?
That is after contractual adjustments. Because what an increase in your cost-based reimbursement does is it decreases your contractual adjustments, so you get more
That's the
revenue.
non-Medicare contractual adjustments, the 800,000.
We have contractual adjustments for Medicare and non-Medicare, and that Medicare contractual adjustment will go down. That negative adjustment overall will go down, so that's worth about 800,000 to us. Because we,
Because
I
I thought we
figured
already
that.
factored that into the $200 a month.
Mhm.
I thought that, the reimbursement of $200.
No, because we just
More.
got 200 a month.
So you're thinking it's gonna go up higher than that?
I think it will,
Okay. Okay.
because of the costs going up.
Okay.
Yeah, so I think we're close there,
I
Dana.
don't know.
Close enough, friends.
I'm not sure about that.
Okay. Next. Again, we got sleep center in 97, reference value 1.2. And actually, I think the left reference value may outperform that. It's going great guns.
Which
Yeah,
one is?
so to speak.
The reference last one.
Well, I found some more money, I think.
What?
So we didn't get on with Kroger until half the year, was that
Right.
right?
So
So
that's
that was,
another-
that's how much, that is another couple hundred thousand?
Another couple 100,000. I think I did mention 340.
Okay, so that's, all right, now we're whittling it down. So,
You go.
I think we're close, guys.
The,
Yeah.
the sleep center's been open for what, 3 months now?
2 months.
2 months.
2 months? What kind of revenue have we gotten during the 2 months?
Yeah, we've got revenue.
Well, I'm not surprised
Business
we got revenue, I was asking
That's
how
how
much.
much.
The reason I'm asking is because Swedish closed their sleep center. You cannot spend the night at a sleep center at Swedish Issaquah. I think they may have one at Redmond, but at any rate, what, the big thing now in sleep medicine is take-home sleep tests. And so I just don't want us to be over-optimistic on this because the amount of activity they had at Swedish was such that they closed their sleep center. And they've got a catchment area, you know, many times our size. So just don't be too optimistic, I think, on the sleep center, in my opinion.
Thank you.
Yeah, but I want to hear the answer to his question, how much revenue has come in the last 2 months for the sleep center?
I don't have it. in front
I
of me.
don't have it.
Oh, you don't?
Yeah. It's in the startup phase, so it's not hand over fist at all, because it's startup, it's always, you know, it's the same conversation we have with everything else, it's a slow turnaround to come back.
We went to
Well,
say
how-
starting up
With the number, yeah.
over the next few months.
Pro forma, because we can see how many people we're getting in for referrals, how many people are in queue, how many people are, you know, how many people are doing their home sleep study right now. We know what percent of those translate to in-lab studies, so just using what we already have in our hands right now, looking into the next 2 months, because the next 2 consult days are completely booked up. So we're booking out weeks, because it's not a daily clinic, it's one clinic every 2 weeks. But just being able to see that and knowing how to translate those, and it's not counting not counting every single home sleep study is converting to an in-lab study. It's just probably 80% of them will convert.
So if the clinic is open 2 weeks, every 2 weeks, how many patients can be seen for that
In the
particular?
clinic?
In the clinic.
So per day, we can get about 12 people
12?
through the clinic. And then the clinic is just where you prep them to go into their sleep study.
I see.
And then the sleep lab is open 3 nights a week.
Yeah, sounds about right. Revenue. I just viewed a couple. Not here,
just-
but I know
Yeah.
Yeah.
about how much they are.
Summary, detailed work, budget developed by department, manager participation. It's a complicated process, like I said, it starts in September. Conservative on volumes, full effect of 2 programs, some increased cost-based reimbursement, I'll add that to it. So that's the high level of what we did. Next. Capital request, you're not approving capital expenditures now, I promise. But we have some requests we will probably bring to the finance committee to replace some patient beds, 5 new patient beds. Again, that's a separate, you're not approving that now, we're not gonna spend the money without running it by you. And we're going to do a lease versus buy analysis before we say we wanna spend the cash. what makes the most sense fiscally to do.
Would that be a logical place for Overlake to invest capital funds?
I would say a more logical place for, this is just my opinion, Overlake to invest capital funds is, yeah, okay, equipment replacement, but an infusion of capital that would grow services, not replacement. I would, you know, we can afford, whether it's lease or buy, to replace the beds. But an infusion of capital to increase services, increase revenue, increase service to the community. And that was in no particular order. I should have put service to the community before. So, you know, but I'm a finance guy. So anyway,
You're talking about increased programs then, right?
really increased programs. You know, what does the community need? And how can we better serve their healthcare needs?
Yeah, I think that's what we need to focus on.
So, yeah, we will somehow make sure we have the right beds and operational beds and such. All right. Next. Okay, there it is. Small numbers, but we have budgeted a $532,000 bottom line, which means I think we'll be, you know, small break even or better. And David, you're right. There's always.
Shouldn't we budget for a little better than that? Should we budget for like a
David,
positive?
we haven't made that much money in years.
Why can't we budget for like 600 grand and be right on?
Let's take it a little bit at a time. I mean, we had a budget this year of 192,000. Chance we can make it. We've seen some outpatient growth. But, you know, so if, David, if I would have added another 300,000 to revenue, you would have accused me of being greedy. So.
Yeah. So what, did you budget the $60,000 for those beds in this budget?
No. It's a capital expenditure.
Okay.
We budgeted some potential depreciation in there, but we will look and say, do we want to buy it or do we want to lease it when we
I was
make that
right, it
decision?
was around 60,000.
Yeah, at 55. How do you know all this stuff?
I've been on the dang finance committee, asking questions for.
And he sees them come through the finance committee.
Okay, so that's where our budget is. I think that's it. Yeah. Questions, comments? It's you know, like any budget, it's not a slam dunk. We will have to work hard at it. We will probably have more ideas, maybe some more programs even before we affiliate that we can look at next year. But we want to go a little bit better than just break even. Yeah, Gene.
I think you mentioned program growth, and I think that is indeed where this hospital is going to have to grow. Because if you consider the programs we offer compared with other critical access hospitals, or for that matter, other small rural hospitals, we're not offering very much. And we've got to grow our programs, additional programs. I was, as a matter of fact, when I got the call from Daryl, I was actually ready to forward to you Mammoth Hospital in California where Tom Parker is. And a beautiful website, by the way. And again, let me say that our website is embarrassing. We need to plug in money for website development. But apart from that, I was going to send you their website and the list of all the services they provide as a critical access hospital in a rural area. And it's amazing. And that's just one example. There are other examples in the state of Washington where the programs that they offer are just totally amazing, and we just are offering very, very little. And we've got to do better. We're going to bring in new people.
Can I reply to that?
Yeah.
We also live in a non-rural area. When you look at Seattle, when you look at Overlake and Bellevue, you look at Valley General, there's not, I mean, right now Polyclinic is in downtown Seattle. There's a lot of options where we are in our community for healthcare and for needs. Children's is in Seattle. So other rural are much more rural than we are.
Yeah,
We really are a suburb of Seattle.
We are technically rural.
Technically.
We have to be, or we wouldn't be a critical access
Yeah, but
hospital.
we're bumping up against that population.
Absolutely.
We really are. It's
And
not
that's
gonna
one
be
reason
long.
I oppose that building of the hospital in the
We're quite a
first place,
ways
because
from
10
exceeding the population.
minutes away, you got Swedish. And that's why we had such difficulty finding financing.
Okay,
But
Gene, I actually agree with you. Now, and Daryl, I actually agree with you. And David, I might agree with you. But if we were rural, it would be easier to capture the market.
It would
Okay.
be.
Daryl, you said it, we're bumping, Gene, you said it too, we're bumping up against urban and competition. And I think affiliation and a good brand name, I really think Overlake has a good brand name, quality, very quality operation. And that's the way to capture some more of the market, not only by branding, but by being able to afford or, offering some more services that the community needs, wants and needs. You don't have to drive as far away to get XYZ specialists in so, yeah. So I'm agreeing with all five of you. So there. Jen, you want to say something so I can agree with you too?
You don't want to hear my request. I kind of want to whiteboard David's concerns and get to the number that is achievable, and I hope that it's the 56. But if, I see Commissioner Spiker is madly scratching away, and I think that it wouldn't be a terrible exercise for us all to go through that.
I'm at about 41.2 now,
Okay.
so that's kind of where, I keep trying to think about where the money's gonna come from and even if we're up in that much in revenue, our costs are going up too.
Yeah, they have to.
So, now you gotta factor that in, that our costs are gonna be more than last year.
And that is factored in to our expenses, okay?
Okay.
Okay, that's factored in. The expenses are not gonna go up above that number. And you're at 40, what, 41, 42, something like that?
41.2 right now with the best case, taking everything this year, assuming we continue at that level with all of our service lines.
Mm-hmm. Did you factor in 800,000 for cost base?
Put 800,000 in there,
All right.
yeah. And I put the 1.5 additional that we didn't figure in this year.
Mm-hmm.
And I put 200,000 extra at Kroger, 1.2 million in the new service line,
Mhm.
sleep study and
That.
so those
1.2 for just the reference
those-
lab.
yeah, the reference lab, the 1.2 is with contractual adjustments. So it's, we figure it might be a little more than that.
Might be a little more than that, yeah.
1.3.
5,
But you have
1.7.
sleep center too.
Yeah,
Okay.
those two together make almost a little over 2 million, but with contractual adjustments and a little bit more in costs. The costs aren't much,
Mm-hmm.
might be a couple 100,000,
Right.
250 or something, maybe
So what's your
Debt,
number?
bad
at?
debt, charge of care remains the same.
So,
And what are you estimating? What are you
well,
estimating?
right now, I look at this and I'm,
He's nervous.
I am, because I'm trying to figure out where the rest.
Yeah.
I know you know somehow you got to this.
Yeah, we did.
It's
It's
like
very
a-
detailed level. We went
It's like
line
a-
by line by
A
line by line.
calculus equation where you go through like 3 pages and you come up
And
with
we
a
go through
number.
like a whole book.
It's everything in between
Mhm.
that we don't know about. I'm just saying, because I'm the closest to the budget, or
Mhm.
to the finances, I know that that's the extra revenues for sure we're gonna get. I estimate in all day, today's
Mhm.
dollars.
Mhm.
So I'm still at about 800,000 short.
Where are you,
I don't know
what,
what,
did you add in a price increase of 5%?
I didn't do that
Okay, that's the difference.
for the entire amount.
For the outpatient side, we'll gain some from that.
So a couple 100,000 maybe?
2 or 3, probably. And I just made that up, David.
I
I'll
I
bet half a
got it,
million.
I know, but it's
I'll bet
somewhere
half a
in there.
million, yeah.
Let's put consider. Well, you know where I'm at?
Hmm,
3.9, and I needed 4.
okay.
So
So
that's
you're
where
pretty
I'm at.
close.
So. That's assuming we're up 2.3 million in Medicare reimbursement
Mm-hmm.
next year.
Mm-hmm. Yeah,
Medicare and Medicare Advantage,
Mhm.
okay?
yeah.
I'm doing the big picture because that's what we need to know,
Yeah.
not the little.
Not the little
Yeah,
stuff
and
day-to-day.
where we concentrate on is growing new programs, managing your patient mix, and then controlling expenses where we can. Those are the 3 areas.
As long as you say we're gonna get 2.3 million more dollars, give or take 100,000,
Give or take 100. Yeah.
from Medicare and Medicare Advantage, I'm happy with this.
Okay,
I'm okay with it.
okay, yeah. Latest
Okay.
test is,
I'm looking right in the eye.
I know,
Okay,
latest test is we're
Okay.
gonna get more money.
okay.
Yeah.
Then I'm not gonna say I'll see it when I believe it, I'll believe it now.
Okay,
All right.
all right.
But that also means that everybody has to be on the same page and want this community to use the things that we have to offer,
Mm-hmm.
to take advantage of those. And that means the board should be doing their sleep studies there, the board should be having their MRIs. We ought to be investing ourselves in this instead of just always talking about it.
Mm-hmm.
And I think that's something I learned from David when he had a test done here, and I decided to have a test done here, where I'm part of a different system.
And I would encourage everyone to keep this sheet and bring it with them every month. Just kind of take a
That's
look,
important.
see where we're at.
Okay,
You know,
Yeah.
that way
yeah.
You say, well, we're way off, or, oh yeah, we're pretty
Yeah.
close.
Mhm.
Although Steve has those figures, I
You like your own,
do.
Maybe
Yeah,
not
yes.
every month, but could we have a quarterly update on that point?
Well, I think it doesn't take long to do it. I think it's a sure
Okay.
thing. Don't you,
Right.
David, just
Quarterly.
You talk about the volume
Could
sheet?
that be part of the finance committee's report then?
I always do monthly, but I don't take into the 3 months prior.
Okay,
I don't do that, I just
So,
do
are
monthly
you-
where
what-
we're at.
what sheet are you holding up? My eyes aren't that great.
This is,
My eye.
yeah, this is the last page of your,
Yeah.
presentation.
Okay,
Yeah.
That's all.
2020
yeah,
budget.
okay, yeah, now,
That's one.
all right.
But in the future, could we have like a monthly and a, quarterly?
You get monthly financial statements
We get
every
monthly.
month.
Yeah.
how
It's
see
far
where you
we're
are
in
in your
our
budgeted and
packet.
how far
And that's what the
we're-
finance committee reports to you, that's what we go over in finance.
Yeah, and then we do
So
have
you
the
do
quarterly
get
as
that
well.
information every month.
Do you give us the quarterly as well?
I don't right now, and that's why we're asking. if you
Because
could
that would
just
be good to see
Sum up
from.
3 in a
yeah.
row, maybe.
I got it.
So you want to show 3, I see. okay.
Yeah,
Some
So
of
you're
it-
going a little
financial
more-
statements, yeah.
Yeah, we have a display those
Yeah,
showing.
quarterly, go into it with a little more detail.
Right.
I try to summarize, because I do go back sometimes, and especially if we've been in way below budget for a couple of months,
Mhm.
like we were in the beginning of the year because of the February issues. Nobody was open for 8 days.
Yeah.
Yeah.
So,
Snow.
yeah, so, anyway, I'm satisfied myself, my opinion.
I think we need to approve the budget.
Yes.
Their attorney Hauser.
Yeah, I want to make sure everybody understood.
All right.
Commissioner Spikers.
I make a motion to approve the budget.
Madam President, before you do that, you do have to open it
Oh,
up for
public
public
hearing. Yes.
hearing.
I'm
You have a
sorry,
public hearing
forgot that.
before you pass your resolution, so that you can say that you've taken public hearing
Thank you.
testimony.
Thank you, General
You
Counsel.
can't give provisionary.
Is there any public comments to the budget?
No,
Oh.
we either approve it.
Well,
or
it's not directly towards the budget. Should I
Okay.
hold off then?
No, it's public comment time. You can come and speak to whatever your issue
There
is.
you go.
Okay.
Well, specifically, you're taking testimony for the budget,
Budget, that's
public
true.
hearing. But you could take additional comment as well,
Yeah.
Madam President.
So if you have any pros here.
I had originally thought that the affiliation meetings also had public comment. I saw that that's no longer included, so. And it's regarding engaging the community for the affiliation forum, whatever forum you choose to go forward, to introduce the community to the work that you're doing. And incidentally, the energy during the most recent meeting I thought was really, really positive. I mean, it sounds like, having missed a few of these meetings, it sounds like you've made some progress and people are really upbeat about that. I agree that you ought not to approach the public seriously until the fruit is ripe, and the fruit won't be ripe until you have something substantive to share with them. The district has a history of poor attendance at these sorts of meetings. And I would put it to you that if you do the same thing over again that you've done in the past, that you can expect the same results going forward. So maybe consider doing something different. One thing you could consider is to have a luncheon for community leaders and community organizations. Encompass the network of senior centers, food bank, government entities, faith-based entities. Get 15 or 20 of the movers and shakers, the real leaders within the valley, and have essentially like a luncheon, something that has a well-presented presentation about what you're going to be proposing to the public during the public forum. It could be a dress rehearsal for that. I would also suggest that you could videotape that and put that on the website, or to be able to have that as an option, that presentation, to get out to the community. But also ask the people that you invite to this luncheon, these leaders, to then take the information that they have, and maybe you'll have a social media press packet, and ask them to get their membership or their constituents involved in the process, to have them, you tap into their networks to promote this big event that is coming up. When you do have your forum, whether it's a town meeting or whatever format that it has, consider live streaming it. There's kind of an excitement over that. The challenge with live streaming nowadays is getting good audio. The video is very easy. People do it all the time. If you have good audio, people will forgive not the best video in the world, and you'll have a better chance of having people tune in, because they will more likely tune into something nowadays, I think, than drive to a place to attend a meeting in person. And you can solicit questions and comments from the viewers live, and someone can write them down and then hand them, and they can see that those questions are answered as you go along. And I think that Truman would be a terrific person to organize and lead that effort for the videotaping and live streaming of that. The only other comment that I have is that I don't know if you're going to have a public health initiative following affiliation, something on the Verdant model. I would hope that that there's elbow room for that, because to me, that's a real big value add for the valley. So I'd like to have you keep that in mind. And if you do have that in mind, that might be one of the selling points that you could have during this public forum, is saying, not only are we going to continue the excellent medical service that we have, and it might be expanding, but we'll also be able to do these other sorts of things that will help all of these community leaders that will be inviting to this lunch and learn. So somewhere in there, I think, is a different way of approaching the valley at large to gain more enthusiasm for attending and to solicit more support for what you're doing.
Thank you, Scott.
Thank you.
Thanks, Scott. Gave you time to verify, yeah, David, we're gonna make it. I got your revenue number, I had it displayed, sure. And, okay.
All right.
I need to write it down, I don't do it in my head.
I can do it in my head really quick.
I know, you're better than I am. Okay, oh. So, did we vote on the budget?
You can now
But
close,
we're gonna close the discussion,
we're going to close the public hearing.
public hearing now.
Correct,
And then we have new business action items.
correct, and you have two resolutions.
I have resolution 557119, approving and adopting the district budget and tax levy for calendar year 2020, and approving the limit factor for the district's regular property tax levy in calendar year 2020. Also resolution, do we want to do them separately, or do we want to as a whole?
You should probably do them separately.
Separately.
I would like to do them separate.
Okay, and then I'll say the other one and then we'll do them separately. The next one would be resolution 558119, which is approving and adopting the rate amount of increase in the regular levy for 2020, which I don't, done it.
Question?
Yes, Commissioner Clark.
Should this really be combined? That is approving the limit factor combined with the budget approval?
We're gonna do them each separate, I believe.
No,
that's
I'm
what-
talking about in item one, there are two parts to item one.
Oh,
That's all one resolution, they are combined.
They are combined appropriately, all right?
Yes, according to the King County Assessor's Office, that's correct.
thank you. All right, is there a motion to approve resolution 557119, and that would be to adopting the district budget and tax levy for calendar year 2020, and approving the limit factor for district's regular property tax levy in calendar year 2020.
I make the motion.
Do I hear a second?
I second.
Is there any further discussion about the resolution? Hearing none.
I would like to say that this is pretty unbelievable. We went from, when I started, it was 15 million revenue. We're almost 3 times that in 10 years. And that's significant. So that means we're doing something right. Doing a lot of things right. Those are my comments.
But you do have some doubts earlier, so I wasn't sure whether you are really sold to this particular budget.
I think I wanted to make sure that that discussion was in front of all of the boards, so they had a chance to understand
Okay.
He
what,
likes to
what
poke me a
things,
little bit.
what's that?
You like to test me a little bit, and I
I do.
appreciate it.
And I wanted to do that in simple, 30,000-foot level terms, so that people understand not the little tiny things, but what's the bottom line? Why are we getting, this?
Why are we
this
growing?
revenue
Yeah.
so high?
Mhm.
Why are the salaries that high? Why, are you sure that, these are just the bottom line kind of things that everyone on the board should know every year and take a look at this sheet
Mhm.
every month. So, those are my 2 cents.
And I think that's a valid thing. I think we all need to be responsible for it. It's not just the finance committee, and it's not just 1 or 2 commissioners on any of the committees. That's why we have committee minutes, and we read those at board meetings, is because we're all responsible. Is there any further discussion?
Just a question on provisionary, and maybe David, you can answer that question.
Yeah, I think I know what you're talking about. There, we allotted more money, we set aside more money in the budget for perhaps things we won't spend them on, like the 5 beds. We
Mhm.
didn't, I mean, I'm sorry, that's not part of the budget.
Yeah, that's not part of the
But
budget, that's capital.
But there are things, are there not, that we did not?
There's nothing that jumps out at me that we put in the budget we won't spend. Now, that being said, will we continue to look at every dollar we spend and say, do we have to spend it? Yes. That always gets you some expense savings. And, you know, you might decide I can do without X, Y, or Z. But again, that's the day-to-day operation. That's where Karen and Kim really excel, is on looking at that. I mean, we've been going back and forth on coffee service, and we've saved money on it. And it actually, it's real coffee too. Way to go, Karen. Thank you. But, you know, just those type of things, the little stuff, and the big stuff. But take a look at the little stuff. which
Well,
we
for
continue
instance,
doing.
I give you an example that we didn't spend all of the money. I'm looking at I brought this last month's variances to the budget for
Uh-huh.
expenses that we set aside. And we haven't spent all of our projected miscellaneous expense. We're down,
Mhm.
we're still 13,000 above. We haven't, the travel and training, we spent 45,000 less than what we're spending. So these are kinds of things.
People are being responsible.
Yeah, and now, the B&O taxes are higher, so, and I think it was because of, wasn't that, I don't remember why it was, why it
Yeah,
is. But
I think it's a seasonal thing. I think it's gonna.
it comes up at twice a year or something,
Yeah,
right?
yeah,
So
levels
we
out.
have to, so these things, and we're ahead on the governing board by 24,000. We're underspending there. So we don't have to spend, but this is what we allot in our budget. So we may end up, you know, $50,000 less spent than what our budget.
And, you know,
other
you approve a
expenses.
budget, it doesn't mean we're gonna spend it, we're gonna still look at expenses and say, what can we do? And look at revenue, how can we grow? That Kim has another idea percolating in her head,
On the other hand, we have a census that we're doing that we didn't probably put in budget. Did we put that in budget this year?
Well, right now,
Yeah,
we're
we're doing
well
it,
in
but
census.
that wasn't projected, I
Yeah.
don't think.
Yeah.
So that's about 3,000 or something like that. So we'll overspend a little bit here, less than, but we all agreed, we need to get that done by the end of the year.
Mhm.
So
Mhm.
things like that do come up. Does that make sense? I
Yes.
mean,
Just to
we
me.
put it in the budget conservatively. Hopefully it doesn't get to we don't have to spend, and hopefully we don't end up in that position, but it's there in the budget if we need it. Just like this year, again, we had 3 positions that were in the budget for CEO,
Mhm.
COO,
Mhm.
and CFO.
Mhm.
And we only probably used 2, we'll probably use only 2.2.
I'm a good fiber, guys.
Yeah, so, I mean, Steve's been half-time, and Karen's been only here for 6 months,
Mhm.
5 months, so we saved money there. So, you've got to put it in the budget just in case, so.
Speaking of half-time, I think I put my weekend already.
The 2018 budget, we have a COO budgeted because,
Yeah, we did,
Tom
because- yes,
Parker
we
wore the same hat.
You know, we didn't know he was leaving until after we
Yeah,
approved
November
it.
of 2018.
Until we
after
approved the budget. We didn't know he was leaving.
Okay, and then we
Yeah.
move it
Yeah.
over towards 2019.
Yeah, so what,
So it was moved to 2019.
it wasn't in the budget. What we did this year wasn't really in the budget. What we did put in there was CEO and Chief Medical Officer and CFO full-time.
Mhm. Mhm.
So we ended up with half-time COO, basically because only 6 months or 7.
Yeah.
Half-time for Steve, most of the year. and 2 positions for Kim, Dr. Whitkoff, for average.
But it is separate duties and separate scale, pay scale.
But we put aside the money for
Okay.
that.
Yeah.
Are we ready to vote?
So request a roll call vote.
Okay. Can we please have a roll call vote?
President Norris,
Yes.
Vice President Herron,
I'll abstain.
Secretary Spikers,
Yes.
Commissioner Pollard,
Abstain.
Commissioner Carter.
Yes.
3 yes, 2 abstain.
Doesn't have to be unanimous, does it?
No. For this, you must have a majority vote. You reached the majority of the board members that are present and voted. In your next resolution, you must have a majority plus 1. I'll address that when you get to that resolution that is before you now. That resolution does pass.
So the one we just passed is approving and adopting the agenda. The next one is approving and adopting a rate amount increase for the regular levy for 2020, is that correct?
Yeah, I would make a motion to amend that, as we've done every year. To set aside those monies to pay off taxes in the future, even though it's only
33,000. 33.
33.
Mhm.
So your project is only gonna be half million, it's not gonna be 532,000. So, I would ask that those monies be set aside specifically, in an account specifically to pay the taxes when they become callable,
Mhm.
as we've done for the last.
We've got about 102,000 in border
So last
funds
year,
that would go up to
to
132,
To make
35.
that part of the motion.
I'm sorry, go ahead.
I'm concerned that it's not legal to make
Yeah,
that part of the
I would
motion.
concur with Commissioner Pollard's point of inquiry. You should pass your resolution and then
Okay.
pass another motion that says those monies collected under that resolution
Okay,
would be set
gotcha.
aside.
All right.
Because otherwise, you're trying to amend a
That makes
resolution
sense.
and add a new subject matter to it. I would concur with Commissioner Pollard's concern.
Okay.
So I think you should address the resolution that's before you first, and then address the second motion that Commissioner Spikers appears to be prepared to make.
Okay, so do I have a motion for resolution 5581119, approving and adopting the rate amount of increase in regular levy for 2020?
I so move.
Is there,
Second.
okay, any more discussion? Hearing none, we'll go to a vote. All those in favor say aye. Disapprove? Okay, I think it was unanimous, I couldn't tell.
Correct. Since you had called for any nays, there was none, then you will assume that it's all unanimous.
Yes.
So the record can reflect it's unanimous, so you do have a majority plus 1 that's required under this statute in order to accept the additional increase amount.
Madam President.
Yes, Mr. Pollard.
You might want to just, on the second part of this, so Mr. Spikers was suggesting, is put that at the next board meeting rather than to have it here tonight. It just seems more logical that we keep it a little bit separate there.
You
Well,
mean the
it's-
resolution 5571119, is that what you're
No,
talking about?
no.
He's talking about
He's
the
talking about-
proposed motion that Mr. Spikers is going to make. Because it's a special meeting, we have to only consider for action those items that are on the agenda. And so I think it's related to this matter because now he wants to tell you what to do with those funds.
But it's going to be a
It
separate
would be,
motion.
but it's going to be a separate motion, so it'd be a little bit of a stretch. So again, I would concur with Commissioner Pollard that it would probably be best to put it over to the next meeting where Commissioner Spikers would move that the funds that were approved in this resolution number 2 be set aside for the purposes that he's identified.
Okay. So have we done resolution 5571119? Have we approved that? We have not.
You have, that was
We have,
previously
that's what we did.
approved.
Yeah.
And so now we're talking resolution.
No, that was
No,
just
that's
approved.
not.
That was
Okay,
approved
we're done.
unanimously.
Good, all right.
Both resolutions have been approved. We've just asked Secretary Spikers to hold his motion in abeyance for the next meeting based on a parliamentary inquiry, which I believe Commissioner Paul is probably correct. It's another motion, it's a separate action.
Okay.
It's related, but it's probably better if we wait till the
Okay.
next meeting. And I can remind Secretary Spikers at the next meeting that he had a motion. Okay.
All
Thank
right.
you, Counselor. No, I just have a question, parliamentary inquiry type question, which is, do we anticipate any changes in the next meeting schedule that's on the bottom of the agenda?
Have we made any?
Do we anticipate any more changes to this schedule on the bottom of this sheet?
Unless you're getting ready to propose a change.
No? I just want to know when to suit up.
Okay. The next meeting will be a work study Thursday, November 21st, 2019 at 6:30 in the North-South Conference Room. And then a special meeting on Thursday, December 19, 2019. We're scheduled from December 12th, 2019 at 6:30 North-South Conference Room. Do I hear a motion?
President Norris.
Yes, ma'am.
May I?
Yes.
Not listed on this agenda is the affiliation work study on the same date of December 19th. It starts at 3:30.
Ah, that's the
Thank
kind
you.
of thing I miss.
It was listed on the previous board meeting agenda, but
It's
this
on
was related to.
3:30 on the 19th.
Okay, so 3:15?
Okay.
3:30.
3:30. I'm sure you will probably send out
You'll,
notices.
yes, but I wanted to mention in light of Commissioner Pollard's.
Thank you so
Thank
much.
you.
And do you want to say anything about the Christmas party, or anything you've got the responses you need and so forth?
I have a couple RSVPs. It's December 6th. Still time to get in.
I think
Just let me know.
that's fine.
We did.
So
Thank you.
December, we don't have a board meeting except for a special meeting?
Because it's a reschedule,
Oh, I see.
so it makes it special.
Since you changed it.
Okay.
We all checked our phones and added those things in. Motion to adjourn?
Moved, so moved.
Okay,
Second.
all in favor say aye. Aye. Opposed? You didn't say anything, David. Do you not want to leave?
I said,
Okay.
I was the second.
You